everyone, it's Natalie from Spirohealth, Putney in London, and I'm here with my trusty colleague, Bianca, who's going to be my model for today. Because last week I had to go and have a checkup at the hospital for a lump that I had in my breast. And since I've been talking to so many ladies about it, and men, because breast cancer in men is actually really predominant as well. So lots of people have said to me, I don't even know how to check my breast. So I'm going to talk to you a little bit about what you should be looking for and how quick and easy it is. I remember actually finding this lump about 5 or 6 years ago, and it was actually Justin, who was my boyfriend at the time. He found it before I did, so that was quite worrying really, because how long would it have been there in the first place? So anyway, so what do you look for? First of all, you want to obviously be naked. You want to look in the mirror, so you want to look at yourself in the mirror, and you want to look for symmetry, so that one nipple isn't higher than the other. So you want to look at levels of the breast. Also, you want to look at quality of the skin. Has there been any skin changes? So sometimes the skin can get an orange peel look, like a cellulite type look. Look out for any of those changes. You've also got the nipple changing shape, so either inverting and going in, or getting smaller or bigger. Sometimes hair can grow, like different changes. Sometimes you can have a secretion coming out of the nipple and you're not sure what it is, and obviously not pregnant and breastfeeding. So that is on looking. You can also get your hands up, put your hands up above your head, and you can see how the breast tissue moves, and obviously with the muscle underneath. People with implants, I would say do exactly the same tests as I would if you didn't have implants. So then I would get you to lie down, or I would lie down on my back. So pop your hand on my back. And if you were doing it yourself, you're using a flat hand and you're starting from the outside like a clock face, you want to be checking underneath your arm, because those are your lymph nodes. They can come up like little balls, really hard balls. Sometimes sore, sometimes not sore. This is some of the stuff that you need to be monitoring all the time. So under your arms, you've got quite a lot of lymph nodes. Start there and then come around the breast in like a circle. So if you're doing it yourself, obviously you're doing something like this. Side. If someone else is doing it for you, you can start really anywhere. So you ask you to put a hand up above, and you'll just be checking around here. You'll be going right around in a sort of circular manner. Cut the breast into 4 quarters so that you know if you do find something where it is, and you can actually tell your doctor and give a bit more information. Look at the size of it. If you do feel something, it could be breast tissue because it's the time of the month, so it could be swollen, just mammary glands, etc. If you're breastfeeding, it might be a bit tender. You're looking for anything that just feels foreign, and then you're comparing to the other side as well, because you obviously do you do both breasts. So cut it into 4 and feel for anything that feels strange, and then stay on that point. And you want to look for tenderness, you want to look for size, you want to see if that little mass moves with you or it's separate to you. If you've got implants again, you want to see if it's part of the implant, possibly. And once you've found anything that's going on, then it's obviously best to get checked out ASAP, and do not wait, please. So that's my biggest advice. I hope that helped you guys. If you want some more information, or you want to come in for a checkup with us in Putney, I'm happy to do it. Bianca's happy to do it. There'll be people to help you. So check us out on the website below, and thanks for your attention.